Good afternoon, everybody. I am glad you're here. Greetings from not so warm and sunny South Florida. We're getting a little bit of a cold snap. It was in the 40s this morning. That's winter weather for us. Anyways, I'm glad you're here. Do me a favor, let me know where you're watching from in the comments. And if you're turning 65, if you're just starting Medicare, or maybe you're helping a friend or a loved one try to figure it out, or perhaps you're already on Medicare with a plan that just doesn't feel right, today's conversation is for you. If we haven't met yet, I'm Casey Album. I'm the Senior Medicare Advisor here at the Album Insurance Group. Many of my clients joke that I'm like their Medicare co-pilot, not just because I fly, but because I'm right next to them, helping them navigate their Medicare decisions today as they approach Medicare. But I'm also here next week, next year, and even years down the road. And that's the lens I want to use for today's conversation. So here's the big idea for today. Your first Medicare decision quietly sets the tone for everything that comes after. Not necessarily in a dramatic way, but in small, very practical ways that add up significantly over time, kind of like a snowball that gets rolling. So if you're ready to dive in, type me in the comments and let's get into it. So timing is the moment that I see most people underestimate. I recently spoke with a man he's now a client, but when he turned 65, he felt healthy and he thought, well, I'm just going to pick something that's simple and cheap. What he didn't realize was that his first enrollment window was the most flexible one that he'd ever have. The first window affects whether health questions are required when you're getting a Medicare supplement plan. It affects what plans are actually going to be available for you to choose from, how easy or whether you'll be able to make changes later, whether penalties apply, or whether you have to start coverage at 65 or whether you can delay. Most people don't realize it, but you don't necessarily have to start Medicare at age 65, but it depends on how big the employer is or your spouse's employer if you're the covered dependent. Most people don't learn all of that until after their window closes sometimes. Some folks think they need to sign up for Medicare just because they're 65 when they have adequate group coverage that they could keep for a while and it might save them some money. Others make the mistake of staying on that group plan when they shouldn't. Maybe it's not a great plan or it's expensive, and it might be less expensive for them to switch to Medicare and get better coverage. And that gentleman that I mentioned, he was lucky. He had an opportunity to switch from the plan that he chose to a freedom-based Medicare supplement plan with us, and now he's got coverage that actually fits the way that he wants to live his life. And that's what we help people do. So if this is new to you, type yes in the comments. So once you've got the timing right, the first plan choice really shapes your experience all throughout retirement. As I'm talking to people, one of the things that I hear people say all the time, especially this time of year, we're talking to people that are already on Medicare and aren't happy with their plan choices. Like I hear people say all the time, I didn't know my doctor wasn't going to be in the plan. I didn't know the insurance company would have to pre-approve my surgery before I could go and have it done, or that they could deny it if they didn't think it was medically necessary. I didn't realize that I'd still be stuck in the plan when my doctor and my hospital left the network. I didn't realize that the zero premium plan that the guy said was the best plan out there could actually cost me several $1,000s out of pocket if I got sick. And I thought I could just switch easily later. I had no idea about medical underwriting or how that worked. These questions usually come up when someone chooses network-based managed care, also known as Medicare Advantage, when they first start Medicare, without fully understanding how it all works day to day. The alternative, of course, is freedom-based coverage, Medigap, or a Medicare supplement plan, which removes all the networks, removes referrals, virtually removes pre-approvals, while significantly limiting the out-of-pocket costs that you can face. Now, I'm not going to say that one is right or one is wrong. They just have very different trade-offs and they create very different experiences. And you have to know exactly what you're getting into. And that's why in past sessions, I talked about how important it is to have a Medicare strategy based on how you actually want to live your life uh, once you're Medicare eligible or in retirement or semi-retirement, and then making sure that your choice of coverage fits that strategy. Both of these types of coverage create very different experiences, and the choice that you make when you first enroll in Medicare is going to shape your entire retirement. And it's also going to shape how flexible things might feel for you later. Recently, I had a couple here in the office, and they were sitting down with me because their doctors and hospitals had left their plan's network. And they were having a hard time finding a doctor that still took their plan and who was taking new patients. And they ended up with one of these big medical practices that focuses on seniors. They really weren't happy with it, but they didn't know what to do. Now, fortunately, they both qualified medically, so I was able to help them get a new plan that gave them the freedom that they needed. They were able to get a Medicare supplement plan that allowed them to see any doctor anywhere in the country, for that matter, that took Medicare. So they're actually able to go and see the doctors that they want to. They essentially got a do-over, but not everyone qualifies for a do-over. And that's why it's so important to really understand this when you're first approaching Medicare. So if you ever thought, I didn't realize it worked like this, type me in the comments. Here's another point that's important. Prescription coverage is a quiet but critical detail that you can't overlook. I once had someone come to me, they were wanting to change their coverage, and they hadn't signed up for Part D. They were in their 70s. And he said to me, he said, well, I didn't think I needed it. I didn't take any medicine. And I need a plan now. Well, when I was helping him find a new plan, he found out that he had penalties because there's late enrollment penalties for Part D, and those penalties stick with you for life. So even if you don't take medications today, Medicare expects you to have credible prescription coverage. If not, skipping it can lead to penalties. So it's important to get a Part D plan too. It's going to protect your future flexibility, and it's another one of those small decisions that feel small now, but it really matters later. That's why having a trusted guide who can not just point out the details of a plan and how much they cost, but someone who can really take it a step further and help you develop a Medicare strategy and help you fit your coverage into that strategy is so important. If avoiding surprises matters to you, type value in the comments. So now I want to take a minute and I want to go through some of the common questions that people always ask. But one of the questions that comes up at this point in these live trainings is, how can I get in touch with someone who can make this all make sense and personalize it just for me? Well, if that's you, or maybe you're helping a friend or a loved one try to figure this all out, my team and I will be honored to help you. Yes, we're based in Florida, but we help people all throughout the United States. And all you have to do is go to medicarequotes.com/Facebook. You can fill out your information and we'll get back to you, or you can even click to schedule an appointment, grab a time on our calendar that works for you, and we'll connect with you, and we'll help you either put together your Medicare strategy or maybe readjust your strategy and look at possible new options for coverage if what you have now, if it doesn't feel like it's working out the way that you want to. There's no cost or obligation. And if you're already on the right plan that works for you, then we're going to point that out and help reinforce it so that you do feel confident and you don't end up in a situation where you make changes that you don't need to. So let's get into the common questions, because I think this is going to be helpful too. And if you've got questions, go ahead and drop them into the comments and I'll answer as many as I can as I'm going through this. But one of the biggest questions people ask me is, what if I'm already on a Medicare Advantage plan and I just don't like it? Lots of people ask that question, and a lot of folks feel trapped in those plans. Well, part of that's because You may have options, but there are only certain periods of the year when you're allowed to switch. Now, and that's why timing matters too. Now, right now, we're in one of those times. It's called the Medicare Advantage Open Enrollment Period, or OEP for short. And this is essentially Medicare's do-over period. I talked a lot about that in last couple of weeks live sessions. But Medicare has a period of time between January 1st and March 31st of each year where if you're in a Medicare Advantage plan, you can change plans or you can re-enroll in original Medicare and possibly get a freedom-based Medicare supplement plan to go with your Medicare. If that's something that you want help with, my team and I'd be honored to help you. And you can even just drop help in the comments and we'll connect with you and answer your questions. So see if that even makes sense for you. Similar question I get is, can I redo my first Medicare decision? Maybe. I will tell you that it's usually easier to get it right at the beginning than to try to switch later on. It becomes much more complicated to switch later on. And frankly, there's a lot of folks that I talk to that really want to switch, and it's not possible. Happens every day. We talk to people that signed up for one of those network-based managed care plans simply because they liked the idea of zero premium and extra benefits, and they didn't really understand how it worked. And now they've had some health issues and the costs have added up. They've had difficulty seeing all the doctors that they want, or maybe they've struggled to get certain things approved and they want to switch. But what happens is, yes, they can switch back to original Medicare, but they may not be able to get a Medicare supplement plan because some of those health conditions that they've had may render them uninsurable. So the best time is when you're in your initial enrollment period or when you're first starting Medicare. Second best time is now if you qualify. But the key with Medigap is you need to be able to qualify medically in most cases. Now I know there's some exceptions, like if your plan is dropped or if you've moved out of the service area, where you can get a do-over on a guaranteed issue basis. And by the way, if that's you, make sure that you take advantage of that timeline so that you have all of your options on the table. Do I really need a prescription plan if I don't take any medicines? Yes, you do. Unless you've got some type of creditable coverage that you're keeping, like VA coverage, for example, you're going to protect your future options and you're going to help ensure that you avoid lifetime penalties. In many states, there are zero premium plans, which are great for people that don't take a lot of medicines or only take a couple of inexpensive ones. And even in states that don't have zero premium plans, every state has plans that are in the $10, $20 a month range. Some states even less than that. So my advice, if you don't take a lot of medicine, get the least expensive Medicare Part D plans available. Reevaluate it every year during the open enrollment, October 15th to December 7th, because that's one of the things that you can change during the fall. And if your medicines change during the year, reevaluate it during the fall and put a new one in place for the following year. Can I delay starting Medicare? This is a common one too. Well, and that's another one of those questions where it depends. If you're still working and you're covered by your employer or you're the covered spouse and you're covered by your spouse's plan, you may be able to, as long as that plan has at least 20 employees. That's what we call a large group plan. Otherwise, you're going to need Medicare, because if that employer has less than 20 employees, that's a small group plan. You're going to need to have Medicare in place, because what happens at age 65 is that small employer plan moves from the primary payer position to the secondary payer position. If you don't have Medicare, guess who just became the primary payer? That's right, you did. And same thing happens, like if you're on COBRA approaching 65, that moves to the secondary payer position. And if you're retired military, you've got TRICARE for life, same thing. So you're going to want to make sure you enroll. If you've got an ACA plan, also known as Obamacare or a marketplace plan, enroll at 65. Now that's where it gets a little tricky. Technically, they'll let you keep that plan past age 65, but you lose all of the premium tax credits if you're getting those. But if you keep that plan, you have a 7-month window at 65 to be able to enroll in Medicare. Starts 3 months before your birthday, includes your birthday, goes 3 months after. Well, let's say you wait 6 months and decide, you know what? I don't know why I kept this plan. I need to enroll in Medicare. Well, you're outside of your initial enrollment period. You're going to have to wait until the next general enrollment period, which happens once a year, and you're going to have lifetime penalties added to your Part B. So that's another area where timing is important. And just because you have a large group plan doesn't necessarily mean that you should stay on that plan just because you have it. You really need to evaluate uh, that plan. What is the cost? Does that plan give you access to the doctors and healthcare providers that you really want to be able to see? What are the out-of-pocket costs? If you're the covered spouse, you need to look at things like, is there a spousal surcharge to get care? Not uncommon to see the covered spouse, who's the employee, keep the group plan, and the dependent spouse go on Medicare, because a lot of times their Part B premium plus a Medicare supplement premium gives them better coverage, more freedom, and it costs them the same or less than what they have on their group plan. So it's important to look at it and make decisions based on your situation. And having a trusted guide that can walk you through all that step by step is really helpful. Is Medicare Advantage a mistake? Not necessarily. But let's be candid about what Medicare Advantage is. It's managed network-based care. It's an alternative to original Medicare. It works for some people. There's a lot of folks that it doesn't work for. So it's one of those things where if you're thinking about that, you have to know exactly what you're getting into, or you might be disappointed and surprised. Why do people say Medicare is about strategy and not just plans? Well, that's a great question too, because, and that's one that people ask me a lot. And it's because early decisions quietly affect flexibility, cost, and stress later. I mean, think about it. Your choice of a Medicare plan is going to have an impact all throughout your retirement. It's going to determine which doctors you're going to be allowed to see. It's going to determine the level of care that you're going to be able to have access to when you need it. It's going to determine how freely you're going to be able to travel and know that you're covered. And it's also going to determine whether you're going to be able to get the same care 5 or 10 years down the road that you have access to today. And financially speaking, it's going to determine how much risk you have of financial exposure when you have a significant health issue. Again, that's one of those areas where if you have a trusted guide, someone that can walk you through it and help you build a Medicare strategy, when your coverage fits your strategy and you have coverage that fits your life the way that you want to live it, it makes things a lot easier, and it helps you protect everything that you've worked so hard for over all those years. So here's the takeaway from today as we're getting to time here. Most Medicare frustration doesn't come from just making a wrong decision. It comes from making a decision without understanding how it's going to affect you down the road. When you understand how timing, how plan types, and things like prescription coverage can impact you down the road, you're going to be able to make more informed decisions. You're going to be able to make sure that your coverage actually fits your overall Medicare strategy. And for a lot of people, what that means is that instead of constantly having to worry about their Medicare coverage, they can have it silently working in the background, allowing them to focus on living their life and doing the things that they love. So if you'd like help creating or maybe redesigning your Medicare strategy, you can contact us at MedicareQuotes.com/Facebook. You can drop help in the comments and we'll reach out to you, or simply call the office at 954-970-4760, and the team will get you on the calendar and we'll make sure we get all your questions answered. Thank you for spending some time with me today. If this helped, feel free to share it with someone else who's turning 65, starting Medicare, or maybe reevaluating their decisions as well. And I will see you next week at 3 p.m. for next week's Medicare Live. Have a great day, everybody.